Okay, welcome back. So this video is basically it is the continuation of first part of suffocation. In first part, I already discussed about the environmental suffocation, gagging and smoothing. So in this video, we discuss about the choking, mechanical traumatic asphyxia and cafe coronary syndrome. Okay, so we start the topic with what? Choking. Okay, so what is this choking? First we try to understand what happens in case of normal condition. Normally when we swallow any food materials, so during a normal swallowing process, the swallowing reflex are well intact, and this swallowing reflex it ensure that the food particles are enter into the esophagus. They ensure that there is no entry of food particles into the trachea or the larynx. Okay, so this is the first point. But sometimes what happens, due to discoordination or incoordination of this swallowing reflex, some food materials enter into the larynx and trachea. So whenever some food materials are enter into the larynx and trachea, there is another protective reflex which is cough reflex. So due to the ciliary movements, it expels the aspirates whatever enter into the trachea and larynx. But in case of choking, what happens? In case of chokings, there is failure of protective mechanisms. So in case of choking, what happens? There is what? Failure of protective mechanism of protective mechanisms like swallowing reflex and insufficient cough reflex. So if there is the failure of protective swallowing reflex, the food particles enter into the what? Trachea and the larynx, and also the cough reflex are insufficient. So if the cough reflex are insufficient, the ciliary movement are insufficient to expel the vomitus or any food particles, so the obstruction are persistent, and when the obstruction are persistent, it will leads to cause asphyxia, and the person will die. So this is all about the chokings. The next topic is cafe coronary syndromes. So what happens in case of cafe coronary syndromes? If any person in intoxicated state, I means they are heavy alcohol drinkers. So this heavy alcohol drinker or a person having a mental retardation, Alzheimer disease. So in all these condition, it suppress the protective reflexes like swallowing reflex and cough reflex, so having more chance of entry the food particles into the larynx and trachea. So in case of choking, what happens? If any food particles enter into the trachea and larynx, here there is a stimulation of cough reflex which are insufficient. But in case of cafe coronary syndromes, instead of a stimulation of cough reflex, there is a strong vagal stimulation. So this vagal stimulation, they are responsible for a severe bradycardia, and the person will die due to cardiac arrest. So one of the difference between the cafe coronary syndromes and the choking, in case of chokings, the person will die due to the asphyxia. In case of choking, there is no stimulation of vagal stimulation, while in case of cafe coronary syndromes, there is a vagal stimulation which is the cause of death due to cardiac arrest. So this is all about the cafe coronary syndromes. Now we move toward the reading section. What are the things written here? Choking, it is due to the failure of protective mechanism. What is choking? Due to the failure of protective mechanisms. So what are these protective mechanisms? Like the swallowing reflex, and one is the what, cough reflex. So this cough reflex and the swallowing reflex, these are the two protective reflex which ensure that the food particles not enter into the larynx and trachea, and if by chance any food particles are enter into the larynx and trachea, the cough reflex expel out. And but in case of choking, what happens? There is the failure of protective mechanism, or I mean swallowing reflex. So due to the failure of this swallowing reflex, the food particles enter into the larynx and the trachea, and also the cough reflex are insufficient to expel the aspirates. As a result, there is the persistent obstruction obviously, and this persistent obstruction causes asphyxia will develops, and the finally person will die due to asphyxia. Okay. What are the postmortem finding in case of choking? The first common postmortem finding are obviously the cyanosis, petechial hemorrhage, and the congestion. Presence of bolus in a trachea. So if during the postmortem examination, if any food particles are present in the trachea or the bronchis, it is suggestive of what? Choking. ठीक है, okay. The next topic is cafe coronary syndrome. So it is in the cafe coronary syndrome, the asphyxia develops due to the insufficient cough reflex. Asphyxia developed due to the insufficient cough reflex. Also in case of obviously cafe coronary syndromes, there is the failure of this swallowing reflex, because without failure of swallowing reflex, there is no any possibility of entry any aspirates into the larynx and the trachea. So first obviously there in case of the cafe coronary syndrome, also there is the failure of swallowing reflex. So if the swallowing reflex, there is the failure of swallowing reflex, the food particles enter into the trachea and larynx, and the cough reflex are also insufficient, and this cough reflex are insufficient to expel out the aspirates. And also in case of cafe coronary syndrome, there is the vagal stimulation. There is a vagal stimulation, and this vagal stimulation causes sudden death due to the cardiac arrest. Predisposing factors like the old age, Alzheimer's disease, and mental retardation. Traumatic asphyxia, what happens in case of the traumatic asphyxia? Due to the trauma, there is the fixation of the chest. Okay, so chest unable to move, I mean breathing, and the person will die due to the asphyxia. So in case of traumatic asphyxia, what happens if any trauma will occur? So due to the trauma, the chest are fully compressed, and if the chest are fully compressed, the person unable to breathe, and if person is unable to breathe, obviously the person will die due to the asphyxia. So this is seen in case of if any person buried in the ground swell up to the neck. So if someone buried any person into the ground swell up to the neck, the person unable to breathe, and finally the death will occur due to the asphyxia. The second thing is construction by the python snake. If python snake construct any persons, obviously person unable to breathe and die due to the asphyxia. The second is the positional asphyxia. So in case of positional asphyxia due to the abnormal position of body prevent the breathing. So if person is lay down in any abnormal position which prevent the breathing, then in this condition also the asphyxia will develop and person will die due to asphyxia. Barking, what is barking? Barking is the combination of homicidal smoothing and the traumatic asphyxia. What is this barking? Combination of homicidal smoothing and the traumatic asphyxia. So this is all about the different types of asphyxia develop in case of what? Suffocation. Okay, I hope you can understand a little bit. Welcome back in new series.